Hi, this video is the art of hair transplant restoration surgery. This client actually had a procedure done a few years ago, and he had a Neograft FUE by a Neograft machine. And it's different. The result is very dependent on the surgeon and the surgical skill. There's three groups. The FUE surgeon specialist is the surgeon who's sitting there personally pulling one hair graft at a time. That will give you the best result. And so then for the clinic or the surgeon cannot do the FUE, so then they buy the machine called the artist and the robot, and they damage more roots than what the FUE surgeon specialist. So the result won't be as good. And then the worst one is really the Neograft. And why? Because the Neograft is operated 100% by the technician. So a technician design your hairline, they could potentially ruin your look. Number two is they personally pulling the hair graft, so no doctor operating on you. Yeah, they are a little bit cheap, but then in the reality it's not that cheap, because this client spent around $10,000, and then you spend all of this money, you're going to lose it. So it will cost you more in the long run. So the best way to do is really to find an FUE hair surgeon specialist. And so the question when you interview the doctor is always asked, are you sitting there personally pulling the hair graft one at a time? You don't want the robot to do it, you don't want the technician to operate doing it. Because if you ask the doctor, are you the one who doing the surgery? Yeah, making a couple holes and they say they're doing surgery, but that's not the right way to do approach. The best one is that are you the surgeon who personally pulling the hair graft out, and that's when you can tell that he's a FUE surgeon specialist. And the other question is how long you've been doing FUE, not if you do 20 years experience but 19 and a half years on the strip and only half a year on FUE, then that's not good. So if a surgeon do like 10 years or more FUE, then you know he's good. And frequency is important, very, very important. Is not how often you do it. It's like 4 or 5 times a week, or once a month, or once every couple of months. If they are doing 4 or 5 times a week, then you know they have the skill, not just skill but the repetition, and that's really determine the density. And so there's quite a bit involved. And then the artistic and aesthetic detail to design the hairline, make sure how natural it looks. The surgical skill will determine the density. And this client gonna be he's gonna need around 2,300 grafts for sure. And we're just gonna rebuild this one. See, he had a couple of strands from the past Neograft FUE, and it's hardly anything growth. And so we're gonna rebuild the whole wall, and a year later it will look completely different. On average, for Caucasian, from the mid eyebrow to the hairline is around 7.5 to 8.5 centimeter. For Asian and Black, around 6.5 to 7. The more narrow the face, the more arched back the hairline is. The more round the face, the more flat the hairline is. And then the zigzag. Now, we have two types of hairline. They're called the tight hairline and the soft hairline. The tight hairline will give you a smaller zigzag and give you a more dense look and more fuller and a more wow factor. So like, a lot of celebrity, they tend to go with that. The soft hairline is more conservative personality, where you have bigger zigzag, and it looks more natural, but unfortunately it looks less dense because we use a lot more baby hair and bigger zigzag. So, or you can go somewhere in between, and those are more popular. You don't want it too aggressive, and you don't want it too soft. So this is the art of hair transplant using the FUE method, and I'll be personally pulling one hair graft at a time. Thank you.